Thank you for joining us. We are on location in Boca Raton, Florida, at the Spa and Medical Center of Dr. Daniel Mann, the board-certified plastic surgeon who came all the way from Israel many years ago, has a practice here, has patients from all over the world, and has innovated some essential new procedures in this area of his expertise. And we'll meet him following these messages.
Life Extension magazine brings you new discoveries in health and anti-aging. Our science-based research and supplements are so advanced they're many years ahead of the medical mainstream, with quality control standards that exceed FDA mandates. Life Extension has covered groundbreaking medical research for more than 35 years. For your health and future, you deserve the best. Learn more at lifeextension.com.
The space to dream, to create, to build. Any room in your home can become a comfortable space that's all your own with a Carrier ductless system. There's simply nothing more efficient. With comfort controls you can set with your smartphone, filters for cleaner, fresher air, and humidity settings that are easy to adjust. It's just one more way Carrier helps make you comfortable, however you define it. Carrier, turn to the experts.
When I was young, it seemed that life was so wonderful. A miracle, oh it was beautiful, magical. And then they showed me a world where I could be so dependable, oh intellectual, cynical.
Find magic again. Sprout by HP. With Intel RealSense technology inside, now you can bend the rules of creativity outside.
With us now is Dr. Daniel Mann, board-certified plastic surgeon. Dr. Mann, what a pleasure to finally be with you on camera here.
Thank you very much.
I was just noticing the latest edition of your amazing book, The New Art of Man. Very, very interesting. I perused your first book, and here is the second one. Tell us about it, please.
Being a board-certified plastic surgeon, I have a pleasure of being with you. And one of the things that I paid attention to is education for the audience. And I have put together several of my patients before and after stories, as well as my art, and combine them together. And the name of the book is The New Art of Men. It combines my love for plastic surgery and art.
How very interesting it is. I once read a book called Psycho-Cybernetics, that if you change somebody's appearance, their personality to some degree changes. People who are inhibited and shy develop confidence.
It's absolutely true. I do see it over the years with patients who want to change something about themselves. Because when they wake up in the morning, it's nothing like 15 years ago when it used to be fresher and a better look. And they do want that previous look. They want it to look better, but not different.
Absolutely. You mentioned art, and we have to share with our audience later your amazing artwork, sculptures and paintings. How interesting it is that, and how perfect it is for a plastic surgeon to actually be very, very artistic. And how can one not be? So it is a wonderful combination that you are a renowned artist and author and a plastic surgeon.
I would say that it's difficult to separate art from plastic surgery, because plastic surgery, at the end of the day, is what the patients see that has to be good in their eyes. And when you're just a technician, it will look okay. But if it's done in an artistic way, it will be looking pleasing to the eye. And that's what they're looking for. The combination of art and plastic surgery is inseparable. And that's why I worked all these years to put it together.
That's such an interesting point, the combination of art and plastic surgery, the necessity of the combination. It's really essential, in my view, for a plastic surgeon to really have an artistic background and talent. What are your thoughts on that?
Art in plastic surgery is very important. When a patient comes in, they do have an idea of what they look like today, and they're not sure how they will change in the future. And they would like to have an improvement. It should look better, but not different. How else could you do it without having an artistic touch? If you just do work technically, it may be okay, but if you do some work with an artistic eye and good hand-eye reflex, you may be achieving what they're really looking for, to look better, but not different.
How do your patients react after they're recovered? How emotional do they get after they are thrilled with their new appearance?
Well, patients are going through procedures, and there's several stages to it, and one of them is to prepare themselves to look better. And when they plan on going through surgery and then through recovery, they know they're going to have a period of time when they don't look as good. They probably will look worse before they look better. And you have to do a lot of hand-holding, preparing, so they're not surprised, but they're ready for this. And they will say, let's go ahead and get to the goal. I want to look better.
How long does it really take for an individual to recover from, let's say, a facelift?
It's a good question. How long does it take to recover after procedures? It depends which one. If patients are coming in for facelifts, it depends how much of a work that needs to be done, how much the eyelids, the brow, and the face, and the neck need to be corrected. It probably take them about 3-4 weeks before they look better. But many times, they can do some things that will make them look faster and better without necessarily going through a full facelift. And we're going to talk about that too.
Let's do that right now. I understand that you have many non-surgical procedures. Please share with our audience some of those.
Many patients are asking for procedures today that will make them look better without having a lot of downtime. So they're looking for procedures to improve their appearance. For instance, their faces, they don't look as good as in the past. They lost volume. Their muscles are making those 11 signs in the forehead and lines around the eyes. And they want to have both better volume and less upset lines. So we can combine fillers and what's called Botox or Xeomin or other methods to neurotoxins to improve their appearance without downtime. Within a short time, they will look better. That's wonderful because they'll walk out of here and they already look better.
Fascinating. That really is so interesting. But I understand not only do you do cosmetic surgery to enhance people's appearances and rejuvenation and all of that, but I understand that if somebody has a terrible accident and they have scars, you can do amazing things to restore them to a more happy situation.
Well, being a board-certified plastic surgeon, I have to address that question. Do you do other things than just facelift? Well, of course we do. I've done many reconstructive procedures. I've done over 30,000 cases over the years of patients from head to toe, including forehead, eyelid, face, neck, breast, suction, tummy tucks, and various procedures to improve their appearance. Some of them will have a lot of downtime and some less. Since you did ask me about downtime, some procedures will take longer time. For instance, a breast augmentation, the patient, it'll take her a few days to look better. A breast reduction, a couple more days. A tummy tuck, a couple of weeks. We did talk about facelifts. Suction lipectomy will take a few days to a couple of weeks. So I do quite a number of procedures to enhance their appearance, and also patients who had previous accidents and they remained with scars, we improve their scars as well.
So one of the interesting facets of your practice is not only that you are here practicing in Boca with patients from all over the world, but you also innovate, you invent, and you have created new procedures and treatments that are totally revolutionary. Share with our audience some of those details.
Well, it's a pleasure to talk about some new procedures, but we grow on the shoulders of giants. So everything that we do, we have learned from previous masters in plastic surgery. And I have to tell you that what drives me is request of patients to look better, especially if they do have issues such as loose skin, loss of volume, aging. And by combining a solution to such problems like loose skin, loss of volume, and aging, we are able to help patients look better but with less downtime compared to the older procedures. And these are the new procedures that we together, physicians, plastic surgeons, are working. And I have a pleasure to introduce procedures like J-plasma, Renuvion. Renuvion J-plasma is a way that we use combination of radiofrequency and helium. Yes, simple as helium and radiofrequency to tighten up the skin. The radiofrequency is known when it's placed underneath the skin to tighten up the skin, but the helium cools down the radiofrequency so you don't have the heat. And by doing the combination, you're able to get skin tightening but without the side effects. So patients who have loose skin anywhere in the body, like in the neck, in the chest, in the belly, in the love handles, in the arms, we can do procedures on them to tighten up the skin. Where in the past, we used to have long cuts with a lot of downtime. This time, these patients are saying, you know what? It's so much easier to recover and so much more comfort than what I remember years ago. So these are the innovative procedures that you're looking for. Another procedure, very interesting one, for hair. Patients in the past, when they lost the hair and they wanted to grow their hair, we used to take a strip of hair from their back and use that as a transplant to build up new hair in the front or in the crown. We're now able to take follicular units, single grafts from their permanent hair, and move it with a new technology like smart graft. We're able to move those individual hair from one place to another place and allow them to look natural without the big cuts. So now they can walk around later on when they healed and feel much more comfortable because the hair is growing within 3 months, 6 months, and their hair in the back also will be fine because you didn't leave a long scar. So this is great, having follicular unit hair transplant done under local anesthesia, allowing patients to look natural and grow their own hair. And guess what? You can do it again, maybe 3-6 months later, a second stage. So you could take like 1,500 grafts from a patient, move them from one place to another place, and let them recover. They're doing fine, and then they look natural, the hair grows, and you can go back and put some more hair in between. You can put single ones in the front, double grafts later, and triple ones, and make them look very natural because you place the graft in such a technical way and such an expert with our technicians that make it look very natural.
Really fascinating what medical science enables one to do. And speaking of research, how that keeps progressing, so happens our main sponsor of the Shalom Show is Life Extension, doing a lot of research with regard to stem cell and so forth. In fact, Bill Faloon, the founder of Life Extension, lives right here not far away in Boca Raton. He asked me to give you his book, Pharmocracy, talking about how the FDA somewhat obstructs in your fields for decades now, and just of interest. Tell us a little bit about your interest in stem cell research.
I have a lot of respect for Bill Faloon, and I'll be glad to read this book. Stem cells are very important, and I can always learn more about that. Thank you.
Well, of course, future advances in medical research are all more essential than ever. But tell us a little bit more about what you can do for enhancing men's appearances.
Men in America have shown great interest, especially the last 5 years in plastic surgery. It's amazing how the field of plastic surgery has opened up for men, and men embraced it like never before. 30% of increase in men interest is noticeable on a daily basis. Patients are coming in for eyelids, noses, suction, and they're tired of loss of volume to their face. They want to have improvement to the neck. They want to have better appearance. They want to go to the swimming pool and the beach. For heaven's sake, gynecomastia is the epidemic in men. By combining suction and cutting out the gland and skin tightening with J plasma, which is the combination of helium and radiofrequency, they can have a wonderful results, and they can go back to the swimming pool, beach.
Dr. Mann, I was just thinking about another aspect of cosmetics and how some women come to you. I know one woman who actually wanted to look like Renee Zellweger and have exactly her lips, and she had very thin lips, but she came and had surgery and her lips look exactly, absolutely perfect. It's incredible what you all can do. Share this with our audience. To what extent can you turn a rather bland person into a movie star?
Well, what people notice is that they are aging, and women specifically show it in their lips. In their 30s, it starts dropping down. In their 40s, it starts covering the upper teeth. In the 50s and 60s, it's too late. It looks like the show is over because you don't see the teeth. There's no light reflecting from the teeth. And their line of the lip is not the same like it used to be. They have a straight line, and it doesn't look right. So many women are coming just for fillers to the lips, and these are good. You could use fillers, you can use their own fat, and they can have a little more volume. However, you can't use it too much because it'll make it look unnatural. And some of them, if they develop that long upper lip that covers the teeth, you need to do something about it. You can't leave it like this. So what we do is called a lip lift. A small incision underneath the base of the nose lifts up the lip, and it makes it look amazing. They make it look like years ago, especially smokers and people who have thin, long upper lip start looking, wow, like 18, 20 years younger.
Speaking of improving one's appearance, what about droopy eyelids?
This is one of the first things, droopy eyelids, that bother both men and women. As we get older, gravity doesn't change, but aging does. The aging continues to get worse. The droopy eyelids bother the patient to the point that sometimes they can't see very well because the hooding of the upper eyelid. And sometimes just removing a portion of the skin of the upper eyelid would do the trick. But sometimes it's not enough. You need to do the eyebrow too. When you do like a brow lift with the eyelid, it looks so much better. And today you can do it with endoscopic technique. Small incision with a camera, reach up through the hair. You don't even leave scars behind, and you combine both brow lift and upper eyelid and look amazing, both for women and men.
Moving down from eyes further down, what about the nose?
Noses have bothered patients for many, many years. It's not a new operation, rhinoplasty, but it's a better technology today. Using an open technique, small incision, hidden, you don't even see it, we can shape the nose and give the patient not only better shape but better breathing, all in about 2.5-hour procedure, and results that will last for many years. Wonderful rhinoplasty procedure, both for women and men. They make them very happy going through this.
All very important to those individuals who undergo that. And going further down, the neck. Yes.
The neck. Well, you know, the neck is what turns the whole face. The neck is so important because the looseness of the skin bothers the patient. The fullness of the fat in the neck bothers the patient. Without the neck looking good, even the face would not look good. So when we do the neck, we can sometimes do just suction of the neck, remove some fat. sometimes it's not enough. You need to do a neck lift, a small incision underneath the chin, behind the ear, fix up the neck. Wonderful before and after pictures, as you can see here. However, some patients are now asking for neck improvement with no cuts or minimal cuts. And we can do it by doing J-plasma to the neck. We can remove the fat and tighten up the skin. So now, even if gravity continues to be on its course regularly and the aging will bother the patient, the neck will look better.
How about the arms?
Aging of the arms is a problem for women. You know, the long sleeves don't cut it anymore. We live here in Florida. We have so many patients who want to go to the beach with their grandchildren, with their children, and they don't like that sagging. They call it the Hadassah arms and the sagging arms, and all kinds of names for looseness of the skin. In the past, we used to do big procedures, but now we can use J-plasma under local anesthesia, maybe a few days to a couple of weeks of downtime, but the arms will look so much better and they'll be proud again to look like they used to be.
It's really amazing all the transformation that can take place and how rewarding it is to most people who have some degree of hang-ups over these things. What about breast implants and so forth?
Sometimes the only thing that will bother young and older patients. The rest of the body can be perfect, but the small size bothers them. And breast implants have been very popular, but the last few years they have improved.
For so many of your patients, this is such a relief and a spectacular changeover. But what about other ladies who actually suffer from maybe oversized breasts?
We have patients who have large sagging breasts and they really suffer to the point that they can't wear normal clothing, the shoulder pains, and we can do today a breast uplift with a minimal incision. They look amazing. They can go back to normal life and feel young again without suffering from neck pains and back pains. Not the big incision that we used to do in the past.
A topic of great concern to just about everyone, including myself, is what about excess fat?
Well, you know, both men and women are doing their best. They eat right, they exercise, they read about it from day to night. How can I get my body better? So they get personal trainers, they do whatever they can, but they still have some excess of fat. To the point, they don't have a normal life. They want to get rid of this extra fat here and there. Where? They can, in the arms, in the belly, in the love handles, in the saddlebags, in the inner thighs. What do we do for them? We do suction lipectomy. Suction lipectomy can be done today so much better than years ago. It's a lot less aggressive, can even be done under local anesthesia. Small incision, hidden incision, and that'll get rid of the excess of fat. Now they can go back to their regular good eating habits and exercise and feel better and wear clothes. Go on vacation, it improves the economy. They come back and they say, you know, thank you. That's really what I wanted to do, get rid of this excess of fat.
Well, getting rid of excess fat is of course wonderful, but what about the loose skin that results?
That loose skin is really a problem because you see, gravity is constant. You can't change it. Aging only gets worse. So once you lose that fat that you have and you have this envelope, skin, it gets only worse. More and more loose skin. That really bothers the patients. So sometimes they come in and we can do for them some J-plasma skin tightening. Amazing way to improve their body. Not only that we remove the fat with suction, but we can use helium and radiofrequency with a J-plasma to tighten up the skin. Everywhere. In the arms, in the neck, in the chest, in the belly, in the legs. So now not only the fat will go away, but the loose skin will go away. It will not be complete unless they will get rid of that excess of skin. And that's why they come to us.
Dr. Mann, tell us a little bit about your personal background. What motivated you to get into medicine and into art? Obviously, you were stuck with this talent, and maybe one led to the other.
To me, as a young Israeli student, I wanted to become a physician. I wanted one day to see what I could do to improve the appearance of people and improve their life. And going to Tel Aviv University and doing residency in America, in Montefiore, and University of Louisville, was the way to accomplish these steps. And opening the practice here and being a board-certified plastic surgeon, opening here a facility that is fully accredited with a board-certified anesthesiologist, full safety, is a facility that we offer patients all these steps that they can accomplish in one time in most cases.
Absolutely high end. Your facility is incredible, state of the art. In fact, I'd like us to take a walk through it. And before we do, tell us a little bit more about your plans for the future.
Well, I think that I'm creating more and more art. Where is that art? In people who walk around. That art, if it's eyelids or facelifts or neck lifts or J-plasma or breast augmentation reduction, these are the proof for the art, plastic surgery and art. And I like to combine the photos that you see here, the before and after, to show you what can be accomplished. And in the future, there'll be more and more of these procedures where patients can have a wonderful procedure with less downtime and less pain.
What I really want to do in a second is get up and take a walk around your facility and for you to describe your art. Because actually I paint as well, I compose music, and I'm particularly interested in your artwork, not only in your practice. But before we take the walk, tell our audience how you can be reached for more information.
With pleasure. For more information, please go to drmen.com, look up the procedures, or call at 561-395-5508. Thank you so much.
Great. So let's now go and take a walk and look around.
Let's do it.
We're in Dr. Mann's reception room, and I'm just admiring his artwork, such as this piece right here. But Dr. Mann, I'd like you to tell us a little bit about this wonderful sculpture right here.
This wonderful person, she modeled for me over Friday and Saturday, and I did her face and bust with clay, and then fired it and made it cast and bronze. It's lovely because it depicts really her features, as you could see here. Look at the eyelids, look at the nose, look at the lips. This is what we pay attention when we see patients. We pay attention to details, and they need to look right, artistic, and realistic at the same time.
Absolutely. Let's tour your facility.
Please.
I must say, I absolutely love your artwork, and these in particular, of course. What's this room, sir?
Well, art you just saw here of buttocks, young buttocks. A lot of people are looking, both women and men, at buttocks all the time. And why not paint them? That's easy to paint them.
Absolutely. What's this room?
This room is the photography room, which we do pay attention to details of getting the photography to be realistic as possible and represents what they look like before and after.
Dr. Mann, you've got the most amazing equipment and state-of-the-art. Tell us about it, please.
Well, this is fully accredited facility, and as such, we are vigorously inspected every year where we get accredited. And in this facility, not only a board-certified plastic surgeon but also a board-certified anesthesiologist, a doctor. And this is the anesthesia machine. This is all the monitors on this side and on this side. This is the operating room table that I developed myself. I built this operating room table so we can put patients in any position, even in a standing up position. And what you see here, that the patient can get into a standing up position and even do a tilting to one side or the other side and the patients would feel so much more comfortable because it's a wide bed, and so is the surgeon, who can address all the procedures and do it in such a way that there's less swelling, less need to redo the procedures, and the patients are comfortable throughout because the patient is on a bed that is warmed. However, while the patient is warmed, I have a cooling blanket that I wear to cool me down so I'm more comfortable. What we call it the G10 is allowing the brain to work better when you're not hot, so you cool and you can do the procedure with comfort and accuracy throughout the procedure.
This is really beautiful. Your recovery garden is quite spectacular. So tell us more about the spa you have here.
Patients can feel so much better about their appearance. They can have skin infusion where the skin looks better. They can have skin tightening with Viora, with V-Form. They can have sculpture where they can remove fat without surgery. They can get laser to various parts of the skin, the brown pigmentation, the blood vessels. They have hyperbaric chamber. Patients notice that they heal 3 times faster when they have hyperbaric chamber treatments because of the oxygen under pressure.
Absolutely. Show us the spa, please.
This part of the Medi-Spa is the heart of the spa because this is where everything happens, the treatments that you can get here that you get nowhere else.
Show us more.
One of my favorite oil painting, is here in the treatment room where patients have suture removal, skin improvement, and you can see additional paintings around here made of selfie, where the OR-Tech is putting a glove on my right hand. Our sculpture room is a special room where patients can lose 24% in 25 minutes with no pain, no downtime, with fully accredited FDA-approved laser machine.
I see that in your Viora room, you have another beautiful painting.
Yes, this painting in Viora room is what patients see when they wake up from anesthesia. The machine itself helps to tighten up the skin, get rid of blood vessels and brown pigmentation, and laser to various kinds of blemishes on the skin.
Tell us about the facial suite.
We provide skin infusion, improvement with facials that are done in a special way to improve the skin, including the use of DMMD, the special treatment that you can see the before and after pictures. Over here we have a hair transplant room where we do follicular units, hair grafts from the permanent hair to area where the patients need it, done under local anesthesia.
Dr. Mann, I have to ask you this question. I've been on Regent 7 Seas cruises, on luxury cruises, but I've never seen any recovery area or spa as luxurious as yours. Please explain.
This is how it should be. Patients are coming and they're expecting recovery suites, so they can stay overnight. They don't have to go home to somebody who doesn't know what they need. And here they get the care. There's always somebody around, and I'm around to make sure that they do better. And these rooms that you see here is made for couples, and here patients, individual patients who can recover here, and they can stay here even few days with no problems. What they get here is a wonderful atmosphere of healing, and my art or my painting that I've done around it to complement their stay.
Which inspires them all the more.
Yes.
Show us more.
Human age reversal. We may be there already. Human studies are now ready to begin to confirm meaningful reversal of pathological aging processes. These clinical trials aim to alter older humans so that they function as much younger individuals. Even modest success will result in a paradigm shift that will impart enormous societal benefits, such as sparing Medicare from insolvency. Life extension is not standing idle while 5,000 Americans die each day from age-related illnesses. Joining us are physician scientists who want to hurry up these technologies to keep people from aging to death. While life extension is pushing these projects forward, we need financial help to ensure these studies are carried through to fruition.
This concludes our special show for today. I'm Maya Brandt, and thank you for being with us.